The Robert Mangaliso Sobukwe Provincial Hospital in Kimberley caters for the majority of people across all 5 districts in the Northern Cape. This puts pressure on the hospital, creating longer waiting times for some patients. The Provincial Health Department has laid out plans to mitigate the crisis during this financial year.
More facilities will thus extend operating hours to render services in high patient volume catchment areas. Some of the facilities include Kagisho Community Health Center, which is in Kuruma and Khaskhonyane, municipality that will be assisted to fully operate for 24 hours. Whilst Dr. Torres Petiraitsewe, a city clinics in Salt Lake municipality will also be given similar support to extend their operational hours from 8 hours to 12 hours. In line with their service demands.
The department says changes to the operating hours would also need a dedicated workforce.
We'll also be engaging our workforce, meaning our nurses, even doctors, to encourage some of them to avail themselves to work overtime. What's important as a department from our side, we'll have to ensure that we pay everyone who works overtime because we'll need these services extra hands. And some of our staff, of course, are determined and they are willing.
The backlog in surgeries is another concern for the department. There is currently a backlog of at least 4,000 surgeries, and the department has promised to complete half of them in this financial year.
What is more difficult is your hip replacements, orthopedic surgeries, your general surgery. We have entered into an agreement with MEC, which is a private entity, to supply us with theatre and scrap nurses, because that's where our difficulty is in terms of operationalizing our theatres.
With some 1 million people in the Northern Cape relying on the public health system, the department maintains that its 6.4 billion rand budget can never be enough. Nerea Hlakotsa, SABC News, Kimberley.